seizure. Should I get the brush mark? Okay. It's just a bad disorder. It was a crazy situation getting crazier. We've got one patient with a broken heart, another.
Yeah.
Let's get him in a gurney. We were pretty comfortable. We knew what was going on with him.
I'm checking things on the laptop.
He's placed her in the psych ward for observation. The psychiatric rooms are separate from the other rooms because a lot of times people do yell and you want to observe them, but you don't want them in the middle of everything else going on. You want to give them a calmer environment, a more comfortable environment. Hi, Kelly. How are you doing?
Terrible. Why did they move me here?
It's quieter. We gave you some medicine to help calm you down.
What about my heart? What about medication for my heart?
Tell me why you're so sad. I wanted to find out what could be so
Roxy, you're being a good girl.
Distress. And at first she's just saying, I can't get comfortable.
Roxy, you does your door open in a good way.
He died. My dad died.
That box is in the way.
I moved it.
He was supposed to be coming over for dinner, and he never came. Ever since then, nothing but pain.
She's holding her chest going, my heart is broken.
I need it to go away.
I wish that the pain of a broken heart was something we could fix in the emergency room, but it isn't. While I was holding her hand, I was taking her pulse. And I feel an extra couple beats, and then a few skip beats, and things just aren't fluid. They're not consistent. She's not in a regular rhythm. You get an EKG on her, and her labs come back.
Just came in.
Thank you. Talk with you again later. Her blood tests were normal. Her pulse was good except for a couple of extra beats. There were no other cardiac symptoms. It had to be psychiatric.
Hey, my boyfriend needs to talk to you.
He's going to have to wait his turn. We're pretty backed up out here.
There's something you need to know about Kelly.
Hey, feeling better? Yeah, thanks. Okay, missed a few doses on that. Lesson learned. You have some information to tell me about Kelly? Yeah, there's some things we didn't tell you before. Kelly never left her trailer. Not once that we saw.
119 subscribers.
For 2 weeks, they say she hasn't got out of the house.
Alright.
It was a mess. Bottles everywhere, clothes everywhere. It was clear she hadn't gotten out of bed, and there was starting to be an odor. And she wasn't eating. And Kelly wasn't eating anything. That could be important, right? She is pretty depressed. No, I mean she was starving herself. We took her a few meals and she didn't touch them, except for the one ketchup sandwich. She hadn't eaten. She may or may not have drank something. She hadn't been out of the house. It was like she was trying to disappear. That's not incompatible with depression. There's a lot of grief that Kelly's going to have to deal with. Her and her dad were tight. He was all she had. She doesn't have a mother or brothers or sisters or anything. She's not just sad, she's sick.
In here, like a hairball of sadness.
Excuse me.
Hi, Moondog. How are you doing today?
I could tell something was different. There was clearly something going on, and we needed to figure it out. I get the EKG. And I said, this can't be my patient's EKG. My patient looks good. This EKG doesn't. It can't be my patient. Are you kidding me?
Wait a second. I know you. You're on television.
I'm doing okay today. I'm doing good.
Dr. Myers has to speak the words no ER doctor ever wants to say.
Time of death, 11:21.
I had no idea what had happened with her. We did everything in the book that we knew how to do.
And where's the daughter?
In the waiting room, I
gotta go talk to her.
There's nothing else for us to do. I felt horrible. We all felt horrible. At that point, her daughter had no idea what was going on. I now had to go up to her and tell her that her mom had died.
Dina, can you come with me, please?
Okay. What is it?
just need to talk to you this way. To have to deliver that news to the young daughter of a relatively young patient, it's almost an indescribably horrible feeling. And I'm afraid I have some bad news. Despite our best efforts, your mom has just passed away. I'm so sorry.
What? But how?
She suddenly stopped breathing, and a short time later, her heart stopped. We weren't able to save her.
I like cooking
I'm sorry.
and baking.
Sure.
It's a grief denial reaction. We do what we have to do to assuage that during this
Cooking and baking is fun.
She understandably was beside herself, distraught, tearful, crying. It was a terrible, terrible feeling.
Can I see her?
Today I got a CPAP machine thing to help with my sleep apnea that I have.
We had done everything that we knew how to do. No idea what had happened. But the outcome was the worst outcome.
I finally got it. It's right here.
You have a grief counselor. That's what we call it.
This is the bag that is in, and right here's a pocket, and right here it has everything for it.
I almost couldn't do it.
Oh, I'm sorry, Roxy. This is what I got today to help with my sleep apnea that I have. I'm happy about having that machine to help. It's my first time having a CPAP machine.
TikTok Radio on Stingray Music is the perfect place to listen to the top TikTok songs living rent-free in your head.
Man,
Or you page
darn
to
it.
your TV screen. Enjoy all your favorites and more on TikTok Radio. Start streaming today.
There it is. Oh.
What's going on? Stan, take it easy. I need you to lay back. I have to put my radar on high alert. Is there something that might have been missed by that first doctor?
It's Friday night. Get your butt over here for some wine and Scrabble. And you are hot as. Okay, let's do this. Woo!
Hi, how are you doing today?
Dr. Myers. Hey, what's up?
I don't think the patient's dead.
What patient?
The one who died. She's not dead.
She looked like a deer caught in the headlights. It was a look I'll never forget, and I'm sure it's a feeling she had that she'll never forget as well, too. The only thing I could think of was, what makes you think she's not dead?
I was taking off the leads, and then I saw her neck pulsing, so I checked, and there was a pulse.
I see multiple broken ribs. We need a CAT scan. As the lone physician in ER, Dr. Bose has just
Today I got to I got this machine here, and it came with everything in a bag and some other pieces to help with sleep apnea.
And worked on the front lines of Iraq. I thought I'd seen it
And it
all,
got
but I
some
shocked
stuff
me.
today
This
too.
was the first.
You want some of this? You're gonna have to pay.
As I said earlier, it's important not to get distracted by the chaos and to stay focused on the mission, which was treating the patient. No, thank you, but let's get you taken care of first. That's quite an injury you have there. I'm Dr. Bose.
Yeah, well, I need to get back to work, so can you get this thing out of my face?
She's pretty badly injured and pretty drunk. Deep breaths.
You gotta fix my face, Doc. I looked at my limit.
Gosh.
Please, and I'll get some lidocaine. Thank you.
Jeez.
So, who's the Cinderella? You have a slipper in your cheek.
Oh, Crystal. Bitch stole one of my regulars. I told her to back off. She nailed me.
Lidocaine, please.
Wait a second. I know you. You're in television. You're one of those celebrity doctors.
Dr. Bose is a Bronze Star recipient.
Oh, an award you were too.
No, I'm just on the news every once in a while to help injured veterans. Right now, I have to put a local anesthetic in your cheek. It's going to hurt a little.
Uh-oh. Well, whoever you are, you're cute. Maybe we should check her vision. Radiology's ready.
Thank you. We're going to wait for your cheek to get numb, then we'll pull that shoe out. We don't have time to clean him now, guys. Let's get him to CAT scan. Go ahead and remove the water. Let's get the gurney ready. I didn't want to risk him bleeding out because we were giving him a thorough cleansing. Hang in there, Barry. We're going to find out what's going on inside you.
Are you insane? You're really here for the haul like this?
You'd rather have him alive and speaking or clean and dead? Radiology's gonna love this. I couldn't believe that everyone was viewing this guy as some sort of pariah. Ooh, what do you think of bringing a patient in this condition? We don't have time to clean him. He may be bleeding internally. I'm not putting him in the scanner. There is no way. He's gonna mess up the equipment. Get him out of here. Hey, actually, out of time. I thought she would be angry or upset or have all sorts of conflicting emotions.
She's alive.
Technically, yes.
She might be okay, right? Go up there now and see her.
Try to do all that.
What do you think? Can you bring me a patient in this condition?
How are you doing today?
To get his countdown covered patient for radiology.
Switches with
But the
flavor.
radiologist refuses to take him. Would you rather have him in your scanner of clean and dead or alive and stinky? We put him in alive and stinky.
Man.
Here's my school. Looks like we left lines in the
You on the laptop, boy? Okay, we got
Didn't show up in your
plenty of cards.
X-ray, so must be there. So he has a partially deflated lung that could be fatal if it decompensates further. The weight of this cow had hit his chest and deflated his left lung. And now the air was outside of his lung, putting pressure on the entire lung. He needs a chest tube. Stat. So we rush him back to trauma so that we can drain the air out of his chest and allow his lung to reinflate.
Don't tell me to calm down. Tell me where he is. Ma'am, please lower your voice or I'll have to call security.
Hi, you must be Crystal.
Who are you?
I'll take care of this. I'm Dr. Bose. I'll get your other heel for you. Follow me. So what can I say? Sometimes you have to do what you have to do to keep the peace. Have a seat in here, Crystal. I'll be back in 20 minutes. And remember, you have to stay calm.
You know, you look really familiar.
Badass, bro.
Have you ever been to the kitty club before?
Yeah, I just got
I'll be back, Captain.
I got one laptop. And I gotta come when I work. Really fucking good.
Can you get this thing out?
I gotta get some
2 seconds. I'll be back. We getting ready with that chest tube?
see if I can get
Let's prep the area between the 4th and 5th rib on the left side. I'll be back. New mission.
Roxy,
A barefoot woman.
you're being a good girl, and you're adorable like that, good girl.
Otherwise, World War II can start on your watch. Yes, sir. How's that cheek feeling?
My whole face is numb.
Open wide.
Why? You're feeling it, Doc. Oh my God! You just yanked it out. Any bouncer at the club could have done that. So you need an operator or something.
But the bouncer can't fix your cheek. You're gonna need stitches. You have a hole in your cheek. Let's prepare for stitching, please.
Roxy is adorable like that, laying on her bed.
Sorry, has to go to pathology. I think the thing I remember most about that evening is how many times I said, I'll be back.
Wait till you see this.
Have this clean sky. I'll be back. So now I have to get back to trauma to reinflate my cow patient's lung. But first, I have to make sure that the team has cleaned all the feces outside of his chest so that I can make my incision. Even if a microscopic piece of feces enters into his body cavity, he could get a fatal infection and die. Looks good. Scalpel. But he has a collapsed lung, so I have to insert a chest tube quickly. Shoot. What's wrong?
One died. She's not dead. Myers pronounced his patient dead. Perhaps a little too quickly. At that point, I raced back to the bedside, my heart beating. You're right, she's still alive. Start bagging her, we'll call her code again. I couldn't imagine how that could be possible. She was dead by every criteria that we had. Code blue, trauma bay. Code blue, trauma bay. I called everybody back to the bedside.
Coffee.
I'm hyperventilating. And we reenacted the code again. Listen to her lungs and her heart. I noticed she had almost no breath.
This side shows a Starbucks picture, and the other side shows the W for Washington Huskies. I like the Huskies and the Seahawks. To me, it doesn't matter what team wins as long as they have fun.
Also set me up a chest tube tray, please.
Yeah, I went on for a little bit.
Place it into the appropriate spot. Confirm that telltale gush of air that comes out as the tension of the air is removed from the chest. Once that occurred,
I'm feeling really happy today because I got my CPAP machine to help me with my sleep apnea. And this is my sleep apnea item, and it came with some extra pieces. This, and right here's where the power go. Right here's the power cord. This item slips in. This item right here.
I thought she would be angry or upset or have all sorts of conflicting emotions. You see, when we found a weak pulse in her neck,
I'm happy I got that item.
somehow we were able to resuscitate her.
She's alive.
Technically, yes.
This is my first time
It's been fruition. I just went through.
having one, and it gives me a chance to
She might be
learn
okay, right?
on how to use it,
Doctor,
and
you
it
can
gives
do it. This is a miracle. And now I know you're
and it gives an instruction booklet and everything.
Go out there now and save her.
Dr. Myers, can I work? Excuse me. She crashed again in CT. They rushed her to the
Not, I noticed the
Would you like to with us?
sleep apnea started up sometime in the past year.
For his broken-hearted patient. Let's have a look. And he can't believe his eyes.
This is an EKG of an old person. who's got high cholesterol, hypertension. This is not a 30-year-old woman with no symptoms. I look and I say, you got the wrong patient. It must have been an accident. I don't think so.
Oh,
This is not what she's in here for. She didn't say she had crushed chest pain going to her neck. She didn't say that she had shortness of breath.
Yeah.
She just had pain, and it was 2 weeks.
Kelly, this is important. I need to know, does anyone in your family have any heart disease or any heart problems?
No. No risk factors. Nobody in your family had heart disease.
this part goes up on the head,
So there's no reason she should have any.
and this
Any hypertension?
This
cigarette smoking,
part
high
goes
cholesterol?
or the
No,
goes on the nose.
no.
It's just not making sense. So I tell the nurse to bring the EKG machine in and let's do it again. Because I want to see it myself.
They just did one of these on me.
Every picture's just a little bit different, and I want to see what your heart looks like now.
When I noticed the
So I'm standing there with the nurse.
when I first noticed the sleep apnea happening, I wasn't too sure why why I kept on dozing off all the time during the day until I went to the doctors and said something, and I had a sleep apnea test done, and that showed that I have sleep apnea. And now I got this machine to help. I'm oh,
Dr. Meyer's patient has made
I didn't know that. I didn't know that, Janelle,
now he's fighting
until now.
for life. What happened? And his job.
She suddenly started descending, BP in the 70s.
I thought, my goodness, what else could go wrong on this particular patient? I felt horrible. I said that this can't be happening. All right, I need you to suction her tube, please. Let's start on norepi. Open up her fluids wide. Are you okay? Do you need to call somebody to be here with you? Okay. It was a wonderful, warm feeling that I got from her that sort of re-energized everybody that we were going and trying to save her mom for a second time.
CT text on the phone. It says you inserted the chest tube wrong.
What?
He says it's in
And-
this week.
The leasing office has a
Dr. Simmons' patient has no symptoms.
has a room up on the second floor with exercise machines, or where I can go there to get exercise on their exercise machines, and if I wanted to, and I also like going out for walks.
We're doing the ultrasound to know what's going on with your heart. As soon as it's done, we'll be able to get you some medication. Try and relax right now. We're getting all the information we need.
Full moon tonight. So mad I was
Oh,
30-year-old female, no cardiac history, rounds are normal. All the hallmarks of a psychiatric crisis. Story about the EKG. Also, she's all distressed about the death of her father.
I get that echocardiogram, the sound waves are put on the heart, you look at the heart and I'm going, what's wrong? But I don't know what it is.
EKG said I'm lying, but this looks like heart failure.
Look at this. Left ventricular base is hypercontractile, but the left ventricular
yeah,
apex.
I've had edibles. I like edibles,
She's depressed, but she's healthy. There's no reason
and
to have a large heart. Doesn't make any
and I like
Maybe not to you.
getting ice cream that has
Cerebral cardiomyopathy.
THC and
It's also
CBD in it,
important heart.
and some others has just only THC in it.
Your ice cream.
It's gonna make a nice get money session tonight.
Oh,
Yeah, Tammy. All right.
ooh. You're wearing the Max shirt you got from my mom.
For every listener, there is someone, somewhere, who knows the truth.
Huh?
Perhaps that
I
someone is
noticed
watching.
you're wearing the Max
Perhaps
shirt from
it's
my
you.
mom.
You.
Yeah, I like
He
this
will
shirt.
help solve this.
It looks good on you.
serious
Well, she knows you like Goofy, so I think she figured you'd like Max too.
laws a guessing game.
Prince, Ronan.
And destiny.
I got this shirt on today, and that's Goofy's son, Max.
But it's all one big celebration.
I love wildflowers. Little June, so lovely and Prince Charming.
All this and more on Hallmark Movies and More.
She hasn't heard how loud it is. Tammy, Janelle says hi.
I said hi back.
Tammy says hi back.
You put the bowl in.
Calling you.
Get set. There was a girl named Blossom. Thank you for the encouragement.
Today will be my first time using it.
Blossom. Ooh, deja vu.
I just got it. I just got it today.
Looks good. Scalpel.
Dr. Bose needs to reinflate his cow dung covered patient's collapsed lung to save his life. But there's a complication.
Looks like we missed a little spot that fell out of his armpit. We have to clean him again and give him some new gloves.
He's a mess. There's a mess everywhere. The whole room smells. But I'm very concerned that that area on the chest wall has to be very clean. If any trace particles of feces enter into the chest wall, it could lead to a fatal infection.
Scalpel.
I make an incision. I insert a tube and hook it up to suction so we can remove the air that is outside the lung and the chest wall. This will help reinflate the lung.
Now's your chance, boys. Clean him up. Great. And don't be stingy with the betadine. I gotta get back to the lap dancers.
There's more than one?
Got that yolk?
Then that fat slob says to me, you call that a lap dance? And I said,
We don't.
no, honey.
We got no earplugs.
How about a belly dance?
Hey, Doc. I was just doing what you said. I can see that.
Aren't you a darling?
Maybe you should get some shoes that are easier to stand in.
Are you kidding, Doc? That would be the end of my fit. Guys love these shoes. And they make a good weapon of self-defense.
They do look pretty dangerous. Can you escort this nice lady out, please? Yeah.
Come on my club sometime. I'll show you what I can do in these shoes.
One mission accomplished.
Today it's cloudy up in the sky
Cheek feeling numb,
with a bunch of clouds.
I look like a bride of Frankenstein.
Sounds numb. Let's get you stitched up.
We ended up placing a total of 7 stitches on the outside and 6 stitches on the inside. We won't be leaving a scar, just a beauty mark. Right about now, my cow patient is completely clean. The smell
Recently,
is gone.
when I got a
Everyone breathes a sigh of relief.
Dr. Bose's patient did just fine.
phone call from Narco about the CPAP machine, they said one of the things they were saying is for me to practice with it during the daytime
That's a very
and get used to it.
Make sure you come by, or I'll have to come back here and we'll use one of your booths.
They would explain a lot. The drop in blood pressure, the heart rate, the breathing. It won't kill him. Well, at least we know what did it then.
If this is true, I'm not going to be at my hospital very much longer.
I gotta completely refill my bowl. Gotta take a couple hits and get back
Dr.
in there.
Myers is trying to revive his patient for a second time when he gets some shocking news.
I gotta get on my side
He says
quickly.
you instead of a chest tube wrong.
Oh.
What? He says it's in his spleen.
That's impossible. The spleen is below his lungs, and the below the level where it needed to be. Only a first-year intern, unsupervised, might do that. My patient lifetime. And I just began to have this sinking, horrible feeling that if this is true,
The
I'm not going to be at my
the
hospital.
power cord to the CPAP machine. This is the end that plugs into it.
Show me what you're looking at.
And this is
Right here.
the
Did you do chromal images?
power
Let me see
cord
those.
for it.
There.
Right here is the power cord for the CPAP machine.
That's a broken ring, probably from the CPR. I don't think that's the chest tube.
Oh, sorry, you're right. That's a rib.
Thank God. Please have the radiologist call me for the reading.
Yeah, right away.
When the radiologist called, he told me that the tube was not in the spleen, resurrected my hopes for my career at the hospital, and also resurrected my hopes that I could be okay with the patient.
Get this done.
I got used to people being like that towards me that care.
Looks like she's doing better.
Yeah, not too many show that they care.
How are her vitals?
There's not too many people
She had
that shows to
almost normal vital
to me how
signs,
much
which
they
is completely
actually
unresponsive,
care.
which is not unexpected after having been coded for so long. Why don't we get a prep?
Thanks for the compliment
I figured
to
that was certainly the
Janelle.
last time I would probably ever see her, regardless of her outcome. Either she would die, or she would perhaps be in a persistent vegetative state.
She said that I'm a nice guy. That's why I said thanks for the compliment.
Here you go. Oh my
There
goodness.
you are, as long as the person don't get you too grumpy.
Yeah, she even says that. She says Tammy seems really nice too.
Well, we both can be really nice as long as the person don't get us grumpy.
This is an amazing
I've
hospital.
noticed that on
Amazing
both
doctor.
our ends.
There are some things inexplicable by the rules of medicine. I believe that this is one of them. I believe there was some intervention,
And I've
some
seen people get us grumpy.
force that caused this patient
This is
to be able to
one of my
walk
2
around
laptops.
100% normal, while at the same time changing
Ow,
from
ow,
one of the
ow.
worst cases
My
I ever
leg.
had to one of the
Ow,
most
ow.
remarkable saves in my career.
Trying to get it so I can take a couple hits and get things done.
Dr. Simon has an explanation for what's ailing his unhappy patient.
I know what this is. Takotsubo cardiomyopathy. It's also known as broken heart syndrome.
Broken heart syndrome. Broken heart syndrome is a hypersympathetic syndrome where the heart
Yeah.
swells up from emotion. When the heart swells up,
American Idol is on tonight.
that leads to damage. So it all started to make sense.
We're watching Monday
She
Night
was
Raw
having heart
and then
failure
American
from a
Idol.
broken heart. So her heart was failing in many ways now. Not just psychologically, not just emotionally.
I like American Idol.
Once we knew what was going on, we had to move quickly. We
They're
had to
asked.
get medicine on it. We had to
Janelle asked if you're
do
okay.
some of the things that are hard.
Oh, I'm fine. I'm just having my hard times with the bathroom like normal.
The patient was admitted to the hospital. Hello there.
Hey, stupid
How's the pain?
doctor don't
Physical pain.
with my problems with the poop correctly.
She was watched there for a couple days. And within a couple weeks, same amount of time it took her to get
I'm
that,
still having that problem.
the heart swelling resolved. The heart failure went away.
Uh,
She went back to being a healthy 30-year-old woman.
Janelle mentioned that shows Richard. That shows Richard started nurse for 11 years.
Comes in with an
Uh-huh.
obvious problem, have an unobvious problem.
Ugh,
I need it to go away.
I had forgotten
hell,
to
it's
focus
not
on
fun pushing out poop
how the
nonstop.
body is connected to the mind and the spirit, and how her thinking and her
There,
feeling
come
could
check
really
it.
affect each other.
Oh,
So it
Tammy's
felt
right
good to finally
behind
have
me.
the full picture.
Yeah, and I got the phone in front of me with the camera.
When
The,
practicing medicine for 20
at the right
years, I
spot
could
where
get
no one
every
can
year 3 or 4
see
cases
you.
that I don't know the answer to. I don't know what's going on, or I can't
See
figure out.
what
Medicine is
there.
still growing and learning and expanding.
I'm going back
And we
in.
don't have the answers to
All right.
everything yet.
Keep it less unless it comes out more.
Hey, Doc, let me out.
She's
So I
doing
see.
uh,
Look, I learned
she's
something
doing
tonight.
fine today.
A broken arm really can be life-threatening. You were right. Well, what do you know? Hey, good news about Kelly. We're just heading down to her place to pick up some of her
Here's Roxy
Without
being a
leaving
good
afterwards,
girl.
Help her plan a service for her dad.
Dusty's out in
Help her say
the
goodbye.
front
Yeah,
room.
make sure she takes a bath.
If you want to go get
Good
him.
for you on both counts. Beautiful moon today.
1 o'clock. He likes to go with on that one part. One spot he likes to go is in that one upper part.
She said, is she having troubles with going to the bathroom?
It's number 2. I poop where I push out poop a lot. It doesn't matter if it's hard or, mushy, hard or runny. I tend to have to keep pushing it out.
I was gardening in the backyard and I stepped on something. I felt this pain and I saw around us.
I got the camera facing me.
I know.
If this inflammation goes untreated very long, then she dies. You need to do something.
I got it where very little light brown and clear right now.
Just had a C-section. We're shocked.
I try to take a little longer break.
I don't know if she
I give her a 5% chance.
does have that.
Part of you
What?
just says everything to keep her alive. My colleagues give her 5% chance.
Yeah, I heard.
You know, and head holds or something. I don't know how to pronounce the word correctly.
I don't know.
It's spelled HEM.
Feeding along with young kids.
Oh,
Levels of fresh fruit
man,
and
looking through the bottom part of my glasses, since the lenses is bifocals, it says hemorrhoids.
Oh, hemorrhoids?
Yeah, I needed to see through the bottom part of my
I don't
glass.
know. Oh no, I've been dealing with having to push poop out nonstop, no matter if it's mushy poop or.
Go with Linda here. She'll take you to the nursery. Be with your baby. We'll look after Karen.
I see where Dusty is. I'll go get him.
Step out of the room.
Here's Dusty.
Baby boy.
Dusty, you adorable kitty.
Get more baby boy.
Internal medicine has already been called, and doctors had time to get there. Physiologists have also.
We had some strawberry yogurt this month.
Suddenly she sees minor convulsions. Did anything else immediately happen before she seized? The nurse reported that Karen said that her chest felt heavy. Any past seizure history? Nothing. She's in top shape.
This kitty's
University trial
adorable.
started, She still runs. Vitals? BP 150 over 70, heart rate is 90. We can't read an oxygen level. No oxygen level. There's no reason
That
for
jar
oxygen
just
levels
went
to
off.
be low.
Whoops, sorry, kitty. Sorry about that.
EKG reads right ventricular strength. It's not a heart attack.
What about an electrolyte imbalance?
It's gotta be something else. You know what this could be? Is an amniotic fluid. An amniotic
I'll
fluid
go ahead and
is a rare problem
rerun the dryer.
amniotic fluid that surrounds
The-
the baby in the uterus.
The blankets are filling damp, so I restarted the darn dryer. The closest grocery store to us is Safeway. and that's a half a mile away. What did I put in here? Oh, cheese in this container. Past few days, I made mac and cheese with hamburger in it. And there's also a Dollar Tree that's a half a mile away the other direction. The next time I'm out, I can go over there and check. Good, this cat box is clean. I did a live stream earlier today. Doing dishes. I think I might have seen that brand of yogurt at Safeway a few different times, looking around at all the yogurt that they have. Okay.
Came out clear. You want to go for bread?
Yeah, I have a PayPal. And I have my PayPal link on my YouTube channel.
You my dusty. Come here.
On weekends, Dr. John Lucas
I
takes
see my
a nap
dusty
in trails
boy.
and state parks surrounding his rural ER.
Hurt
yourself? Just rolled my ankle biking last weekend.
I see a dusty boy.
Tammy, she asked if I have PayPal, and I said I let her know that I have PayPal, and my name for the PayPal is on my YouTube channel. And she also said that she'd like to help you get some yogurt in it.
He's 140 over 90. Heart rate 110. Looks like a snake bite on the ankle, but that's what we've got for you.
And the brand of yogurt that she's talking about the brand is Stonyfield. It is Stonyfield probiotic yogurt that she's talking about.
Lori Atkins.
So I hear you've been bitten?
I was gardening in the backyard and I stepped on something and I heard a noise and then I felt this pain and I looked down
I do like
and I saw a
yogurt too.
rattlesnake.
Wow, it does look like you've been bitten. Let's start some normal saline and can you give me a CBC, a CMP, and some coax?
She mentioned that she said it helped with the
A copperhead and a
nonstop.
rattlesnake can actually look quite similar. It's far more likely that you were bitten by a copperhead,
That
which
wouldn't hurt
thankfully is
trying.
a lot less dangerous than a
Oh.
rattlesnake. The bite of a copperhead snake, while causing a lot of pain and making someone feel quite ill, almost never results in any long-term damage or significant illness.
I'm sure it was a rattler. I know the difference.
Well, our
I'm
tests will
close
help
enough for
figure
you for
out. I'd like
her
try
to
and stay as
hear
calm as
you,
can,
Tammy.
because if you have any venom in you, this will help slow its spread. How does your
I've
leg
talked to
feel?
plenty of doctors that didn't help, and wouldn't hurt to.
Do you have any other unusual sensations anywhere?
I haven't tried this out.
And my fingers are numb.
The other possibility is this dry bite.
I hope so. A dry bite.
Venomous
It wouldn't
snakes
hurt
sometimes
to give
don't
this a
inject
try.
out poison into anything that they don't want to eat.
I like
In other words,
yogurt.
it knows enough to not squirt you with much venom, just enough to say, don't step on me.
We both like
In
yogurt.
those cases, it's
Yeah,
just
we
the
do.
puncture wounds. There's no venom. They don't get sick. When I get some results, I'll come right back. Okay. What's going through my mind is, this is probably
Baby.
another copperhead bite. Because
Cause
obviously
you
this
my
lady's looking
baby
pretty good
boy.
for somebody who's just been bitten by a snake.
Tammy?
Cameron, can you give me an ETA on that blood work? Is my wife here? She was bitten by a rattlesnake. Went to the hospital.
Tammy,
Was supposed to
I
be dead. And they said, well,
I'll let you lean towards
Hey, Mr.
towards me because of
Yes.
how you're dressed.
Good to meet you. Listen,
Well,
Lori's
not
fine.
dressing
I
me.
think it may have more likely been a copperhead that bit her.
That's how
Must have
much
caused it.
she sent.
Well,
$15.
sometimes in a moment of distress,
Okay.
people can confuse the two, and I'm hoping she was mistaken. Doctor,
Roxy,
we're expert outdoorsmen. We write hiking books.
Three
She knows the difference between
28,
a rattler and a copperhead.
39.
Trust me.
Doc Lucas, you gotta see this.
yeah, I'll get her the yogurt.
As a first-year intern, Dr. Andy Kahn is the low man on the totem pole.
Good morning, Andy. You're just in time. I've got a patient for you.
When you're an intern, it's an interesting time because they'll let you obviously go see the patient yourself and try to come up with your own plans.
You're my pretty
But
kitty.
with the lack of experience,
Yes,
you're
you are.
dependent on your upper
You're my
level
pretty
resident
boy.
and your attending physician to help you make a lot of the
I
decisions.
love you.
Good morning, Dr. Lund.
Good morning, Andy.
John Doe, the police picked him up in the park.
Mommy should take a couple more hats.
I just now took a screenshot
Generally, it said the patient
to
had been masturbating all night and couldn't move his legs. After reading the initial,
of
description of the patient,
of the
he
messages.
probably felt that it was something he didn't really want to
Is
see.
that shows the name of the
I could deal with
yogurt that you're talking about.
nothing. Day 3?
Yep.
I felt like, well, what's the next case? Because this one seems like
Yeah,
a waste
Tammy,
of my time, but I
Yeah.
have to do my job.
she said
He's okay.
it will most likely help her within a few hours of eating it.
I was hearing him making noises,
sounds
grunting and
good.
moaning.
He hasn't stopped.
And it feels like I'm gonna have to go check myself again.
Now she's saying that you're lucky to have me in your life.
Good morning, sir. Usually when I walk up to the room, the first thing I do is introduce myself.
Why
And
do you
offer to
think
shake
I've been
hands.
working with
At
my
that point, his
attitude and
hand was still in
trying
the
to
sheets.
work on
I decided
things
to
with you
just
still?
bypass that.
Can you tell me your name?
Me and Tammy,
He looked
we
at
both
disheveled,
have a
like,
daughter
showered
together.
well. I felt like this is the person that
I'm gonna
could be
take a couple
homeless,
more hits and go
someone
check
that
on things again.
was not
I
in a good
think
living
the
situation.
clearness is
He was very
stopped
sweaty.
and
You see that and you get really
confident.
concerned because
I got a
serious
phone
medical
call
issues,
earlier
whether it
today
be
from the dentist.
heart attack or
But I didn't answer it because I was in the bathroom washing my hands.
make eye contact sometimes.
I'm gonna
but
get
most
a
of the
joint
time,
out and
he's
ready.
very confused.
Got it.
And they left a voicemail.
Okay.
Oh,
Yeah, go ahead and show me the constructive fluids yet.
seeing if I'll be able to
Usually you have to choose the arm.
come in tomorrow
In
so
this
they can
case,
put a
you have to
crown
review which arm you choose
the-
because
on my
the other one was occupied.
on the far
Get
back
a urine drug screen.
tooth on the bottom right here on the left.
When I
My
came
little
up to
Dusty's
evaluate
checking
Um,
out.
And I'll go ahead and go to the dentist to get that done, and then over to Safeway to get the yogurt tomorrow.
Call.
also weak and Freddie. Her brain doesn't work. We can't delay treatment anymore.
Yeah, she is 11 years old.
ER intern Dr. Andy Kahn is dealing
Me and
with
Tammy gave our daughter the name
long enough for a
Bridget
thorough evaluation.
Lynn Terry. But the foster parents changed her name on us.
Though I want to be fast and efficient, I also have to be
True.
thorough.
Hold on, I'm getting a phone call from the dentist. I'm back.
Your patient?
That was the dentist that called me. I'm back.
Your patient?
That was the dentist that called me.
Yes, I did. He is. What's up with your patient?
He's not moving his right leg. Want to get a reflex hammer, a safety pin, try to do more thorough neuro exam.
If you want, but don't waste too much time on that. Did you get a tox screen?
I'm waiting on the results.
And he was ready with his iron.
They left.
Nicholas admitted the
Oh well. Yeah, looks like it.
I'm telling you.
Well, he's quoting one of the great English poets of all time. Do you think Chaucer was inside case? I think there's more going on here.
Oh,
Whatever you say.
looks like someone's here.
So the next thing I did was to really test to see if he was trying to.
I just got a phone call from the dentist
So I put the pen over his nail bed
about
and
a
pressed
crown
down
that they
so
have
good.
for
I knew that if
my
he was
far
looking
back
at the screen,
tooth on the
he didn't
bottom right
move at
here.
all. It's got an upper motor neuron lesion. At that moment, I realized something was really wrong. Dr. Lucas, you guys see this?
Dr. Lucas's patient has suffered a snake bite, and it has
Where is
suddenly
my
turned
mouse?
serious.
There it is.
Look at that.
Lori,
It's still clear.
her legs
All right.
exaggerated when the snake was
Just
2
like
to 3
normal
times.
should come out and clear.
I'm sorry, Lori. I'll get you something for the pain. Cameron, would you please give her 4 milligrams of morphine and 25 of I'm afraid you might have been right with that rattlesnake. It looks like we're going to need some antivenom. Antivenom is the only effective treatment for significant snake
There
bite.
it is.
Would you please order that for the pharmacy?
There.
Their first thing is.
Let me get my
are
phone
you
on
sure
the
you
charger
really need
just
it?
in case.
We don't have a lot of it.
Oh, down at 84%.
So
Good.
we don't
I
give
got
it
my
right.
phone on the
The
charger.
life-saving antivenom has been ordered. It will take about 20 minutes to arrive from the pharmacy.
Just let me know if you have any discomfort. Well, I guess that's the answer. Gosh, really sorry about that.
I'm not getting anyone
Hi.
holding that leg. She can't stand for it to be touched. Can't do it.
You'll be okay. You'll be okay.
It's killing. It's killing.
That's insane. You need to do
That's
something.
the way
It
her
became
leg is.
clear pretty quickly that this was a more severe envenomation.
Blood tests are back.
Check out the platelets. The platelets in your blood are one of the critical portions that help control bleeding. A normal person's platelet count is anything more than 1,000. And we received Lori's platelet count. It was only 7,000. We're going to need to get a bandage on the snake bite and the ivy site. What's happening? Mr. Atkins,
Team
snake
Brown.
venom is affecting your wife's platelet count. People that have less than 10,000 platelets are at risk for
Russell
spontaneously bleeding
Dickerson.
just for no
Never
good
heard
reason.
of him.
Antivenom's coming.
Look calm.
Lori, you can try and remain as calm as you can. It'll help limit the spread of the venom.
Got some.
Excellent. Let's get it going. If you can envision the venom of a snake looking like a little Lego block with 6 dots.
I'll go ahead and
Antivenom is the exact
stop
opposite.
this one for
It
now.
fits perfectly against those Lego blocks. And those two things together, when
I'll
the
do another
antivenom
live
and the
stream
venom come together,
for
they
us
fit
soon.
together exactly, and your body can get rid of